Congressman. My name is Marie Deese. I'm from Danville IN. My husband and I own a small business, and every day we have to compete. Some days we win, some days we lose. I pay $10,000 a year for a $5,000 deductible. I have never used my health insurance. Thank God, I've never had a catastrophic health problem. It goes up 20% every year. I have tried one of these on your list. I have this week about grouping businesses together, small businesses together. They still went by individuals. So there were, we were let out again. Over the past 7 years, we have paid a little over $70,000 in health insurance premiums and have never used it. And every year they go up 20%. Now, where is this end? When does it end? The first 2 years, my health insurance was more than my house payment a month. And I was wanting to know, where does it stop? I want to go someplace where I can have a competitive bid. I don't want health insurance for free. I'm willing to pay for it. But when I've got WellPoint and just the few that I can choose from as a small business, I'm left out in the cold. And it's getting worse. I'm getting priced out of health insurance. And I believe, and I know I'm a minority in this room, that a public option is good. I will keep my private health insurance. If I want to be able to go to the table, just like I give quotes every day on the telephone. I want to be able to go to Consumers Life Health Insurance, is who I have insurance for, and say, listen, this is what I can get here for the same thing. What can you do for me? And that's what my husband and I do every day. Now, what is so bad about that? And I want to know, if the government option is not good for me, would you be willing to give up your taxpayer health insurance?
I voted. The advocates of a public option voted against the amendment that required the inclusion of members of Congress. Now, isn't that a curious thing? So those of us, ma'am, when you just taunted me to say, go into that plan, I voted, ma'am, I voted for members of Congress and the executive branch, the legislative branch, to go into the public option. I voted for that. If you're going to do it, then the leaders in the country need to lead. But the advocates of the public option said no. Now, I just wanted you to know, ma'am, that's a curious thing. Now, what I would do, this is a very good discussion that you just had. I appreciate your argument. I would say that with regard to associated health plans, even when Republicans were in the majority, we passed that in successive Congresses. But my Democrat colleagues in the Senate then, they would not move them, we couldn't move the measure. They would not support increasing voluntary risk pools so that you could associate yourself with other small businesses so you have leverage in the marketplace. Yeah, well, I'm not surprised.
It's like putting money on a roulette wheel. Going to Las Vegas, I put money down every year.
Yeah.
And I get nothing for it. How come at least not 20%? Do I not have to let it go on 20% next year?
Yeah. Man, what I would want to do to help you and similarly situated individuals is work on a private market-based solution, not government takeover.
Okay, here's another question. It's two-part. Why does Congressman Buyer oppose the SCHIP program, and how will you address the shortage of primary care physicians?
The SCHIP program was created by the Republican majority. I supported the SCHIP program. Now, why did the Republican majority create the SCHIP program? We created it when we did welfare reform. So in order to move people from welfare to work and give it an inducement and incentive for them to get off of also then the Medicaid rolls, as we move them from welfare to work, individuals would then work at businesses that would not provide health care, and we wanted to then cover the children and created the SCHIP program. When we created the SCHIP program, we also, this is an error that was made. The error is that I said, let's not dictate unto states, let's give authority to governors to lead. Well, that was a mistake. Part of that mistake was in that my individuals, states out there that were then run by, in particular, I'll pick on New Jersey, or I don't know, just pick a state. It was run by a Democrat governor. What did they do? They grew the SCHIP eligibility. And that you could do that so long as the economy was growing. But as soon as the economy took a turn, then what President Obama did with a lot of the federal bailout money, the TARP money that the banks returned, he then, in turn, illegally, I believe, illegally took TARP money and gave it to states. That was never, ever the intent of the TARP money. But they did it. That's what I got upset about. The second thing I got upset about with the SCHIP is that I voted for an amendment on the last reauthorization of the SCHIP program that said, give me a guarantee that the SCHIP program has fully funded all children that are eligible within the program before you mushroom it to include adults. And adults now are included in the SCHIP program. That's what I was against. The other, with regard to increasing on primary care physicians, is probably one of the greatest challenges that we have in our country. When you look at the number of individuals who are in med school today, trying to encourage them through whatever inducement, incentive, or beg to go into primary care is a great, great challenge. And I'm open to anybody here that's got ideas or suggestions on how we can increase more capacity for primary care.